back here today, man. I got my man, Dr. O, leveling the playing field. How you doing, Doc?
Man, I'm blessed, man. How about yourself?
Man, we're good, man. Appreciate you as always. Man. Thank you so much, man.
Always a pleasure.
For being a part of this journey, man. Without you the last couple of years, man, none of this would be possible. So I just want to thank you so much, man. So how things have been going?
Man, just growing day by day, growing day by day. I appreciate you having me on today, man, because I really want to talk about some synergy you and I are building, and I think that people need to know about.
Yes, they do need to know about this. So yeah, let's go into that. Well, first of all, like I said, I think you and I have been doing this since, January 2023?
Yeah.
I think December 2022.
That's when we first started off.
Yeah, when we first started off, man, and I just remember Keetwan just giving me a call, telling me, man, you blessed and you don't even know how you. I'm like, okay, And the next thing you know, man, we got that call, and we linked up, man, and we have been unlocked ever since. And the things that we're just doing in the community, with getting with these guys and trying to educate them on sports health, and it's increased my knowledge because, again, yes, I have a son that's in that field, but it's not as detailed.
Right.
So we just want to let everybody know, how important this is. So I just want to kind of give you to kind of go into that if you can.
Oh, absolutely. Absolutely. And I want to tell you, man, this is the beginning. This is only the beginning. We're going to the moon with everything that we're doing. Between your platform, and starting off this Level the Playing Field platform on YouTube, we want to see this health, education thing really take off.
Yes.
We've gotten to a point where we need to see things change dramatically, all right? The health disparity in sports medicine, it's unacceptable, right? And we can't rely on outside forces to fix that for us. In our community, we need to make an opportunity to change that.
That's right.
Right. And using our platforms to do that is how we do it. That's how we've done it historically. That's how we're doing it now. So, just to give the listener a little background about what Level the Playing Field is about. So
Yes.
It's a YouTube channel. You're intimately connected with what you're doing with BallinVA.
Yes.
Right. And on that YouTube channel, we're going over all sorts of things, sports health basics, basics about the healthcare system, which could be hard to navigate, right? Basics about, just sports injuries, how you come back from them, how the treatment is. Even got some things about, details of surgery. Some people want to know a little bit more for their own knowledge, and maybe they have an interest in the field, right? And so we want to see everybody from all backgrounds have access to that information.
And it's so important, man, because again, I have my own couple of issues and stuff like that. And just talking to you, giving me more knowledge and details, the simple things, I'm like, wow, I could have done this, or I could have done this. And a lot of times, man, we don't get the information that we're supposed to. We're a lot of times constantly misdiagnosed.
Right.
And that's important that when I try to get people to come see Dr. O and enjoying Level of the Playing Field and watching the YouTube new channel, because I'm telling you, it's going to give us a whole lot of information that we just don't know about that's out there.
Right.
And if we just maybe ask the right questions, or maybe have just a little bit of inkling of what's going on, it'll take us from here to here. So I'm just glad I'm a part of this here. I just think it was kind of like fate, kind of thing.
Oh yeah, no, it's definitely a higher power that brought us together here, and that's we rely on that, right, to do what's right morally. Because I think there's a moral compass here, right, that this is requiring from us to make this change in the community. Absolutely. So I was talking to Billy McMullen earlier today, and we were kind of talking about kind of the role that health plays in daily life, the community, and the sports in particular, right? And there's this real interaction between physical and mental health that needs to be addressed, that needs to be kind of worked with. And we really see gaps, and we see gaps in all aspects of health, but in that particular aspect of things, we really see the gaps. And so we're really trying to elevate knowledge as it pertains to that. I'll give you an example that I gave him. One of the biggest ties to not returning back from an ACL injury is actually psychological, right? It's the mental health component. There's this thing we call kinesophobia, wherein a person has kind of a fear of movement because they're afraid of getting hurt again, right?
Yeah.
Right? And so it's a natural reaction. You get hurt, your body wants to protect itself. It makes sense, right? But if you're returning to a sport, if you're moving in such a way that your body's not trusting itself, you're actually setting yourself up for another injury, right?
Oh.
Right? Because you're not moving naturally like you need to be moving, right? And so that kinesophobia is very much a connection, or a variation of the connection between the mental health and the physical.
Right.
Right. We need to start seeing those things as one entity and not as, well, okay, well, you tore your knee, fix your knee, you're good. It's not that simple. There's so much more to it mentally, psychologically, societally. It's levels to it.
So let me ask you this question in regards to that. Is there a big disparity or a big difference between the men and the women, or the boys and the girls, when it comes to stuff like that? Like you're hearing, like, let's say for instance, like I may know an athlete that may have tore his ACL. That's a guy that's playing college basketball. Is his recovery time quicker than it would be for a female? Is that true? Or can you kind of give us any type of details into that?
Or insight into that.
Yeah,
that's what you brought up is actually a very deep question that has a lot of layers to it.
Okay,
that I'm happy, but I'm happy to go
okay,
into.
Okay,
we got time. We got time. We can go into that.
Okay.
Absolutely. So the male-female disparity in ACL injuries has been studied at length for near 20 years over in the orthopedic literature and the scientific studies. Some of the stuff has some weight to it. Some of it is not true. So we have to dispel some kind of, let's say, misconceptions.
Right.
As it relates to that, okay?
Big misconceptions.
So the common theory, leading up to maybe about 5-10 years ago was female athletes have different morphology.
Okay.
And the way that they're built is different. That predisposes them to injury, right? People would say things like, well, they tend to land with their leg out. We call it valgus, but almost knock-kneed. Right? The tendency to land knock-kneed drives females having ACL tears. People have even gotten as deep as hormones and stuff affecting the ACL, which may or may not. But, I was part of a study that we published in 2018 that actually evaluated the mechanism of injury, how the knee is positioned when you tear your ACL. And we compared males and females and found there actually wasn't a difference.
Wow, that's important.
Yeah, there was no morphologic difference in terms of how their knee was positioned when they tore their ACL between males and females.
Wow.
So that means there's a whole nother level of this to it, right? We had to start thinking about things like neuromuscular control, like how strong you are around your knee to protect it between males and females. And I think as you delve deeper into it, what you'll actually find is actually a disparity in how males and females are treated.
Okay.
From an athletic standpoint, right?
Okay.
The ability to have access, or rather the attitude towards some female athletes may not be as stringent, right? That they're going to be able to handle neuromuscular training, right? To be strong throughout the knee, throughout the protective muscles of the knee to protect them from getting injured, right? So the disparity is not in, how they're built or how they're made. The disparity is actually about how they're being treated, right? Are they getting the same resources, right, or same attention as it pertains to being strong, protecting their knee, right, as other athletes, as male athletes? One of the biggest drivers of the ACL tears we found, right, is actually related to how your quadricep muscle works.
Okay.
So those people who land when they're making a move, right, in more extension with the knee straight, they have more of a tendency to tear their ACL. That's how it naturally tends to tear. So people ask, they see it on a game or whatever, dude or the lady just changed direction, suddenly they tore their ACL. Well, nobody hit them. What happened?
Okay.
Well, what happened is a lot of times you land with your knee near full extension, nearly straight, and then that actually pulls on your shin, your tibia, right? Directs the force from your quadricep muscle through that tibia to pull it forward, which is actually what the ACL is supposed to be stopping you from doing.
Oh.
Right. And so that quad overdrive, right, landing with that knee near full extension, right, very much predisposed to ACL tears. And that has a lot to do with the strength ratio between your quadriceps and your hamstring.
Okay.
Right? And so that's where all this preventative stuff for ACL injuries comes in, is trying to create an environment where athletes are stronger in those areas, or they're balanced in that area, so that they're not having that predisposition to being torn, right? And so I think what we find, if we keep delving down into it, is that maybe these female athletes are not getting that same attention as it pertains to injury. And so a lot of times things that we think are related to gender or related to race or related to whatever are actually due to access to care.
And I'm glad you cleared up, because again, it's always, because when you said, the fear of it, it's like, oh, well, you a guy, you can do it quicker than with a female, because it's always, you doing that. And I'm just like, well, like you said, it goes down to care.
Right.
And if she's not getting that care, then she may not be able to push herself the way that a male would, because he's getting different care. So, no, thank you for clearing that up.
Oh, yeah.
So I know I kind of, worded it differently, but you did an excellent job of doing that. So, no, but what else information you can kind of give us that we can kind of go into, like, just generalizing? What is kind of the biggest diagnosis that you kind of deal with on a daily basis?
Yeah, I mean, so me personally, I do a lot of hip surgery, arthroscopic surgery,
Okay.
minimally invasive surgery on the hip, right?
Okay.
And so there are structures inside your hip, your cartilage and your labrum, which is kind of like a cushion inside your hip, that can be torn with sports injuries and other things like that, right? I see that misdiagnosed a lot as a groin pull or like a little hip flexor strain. When actually a lot of these people will have a tear of their labrum or something called hip impingement, where their hip is not functioning or moving with the same range of motion it needs for you to do your thing safely, right? And so the problem with misdiagnosing that is that they don't get the treatment they need from it, which to your point, yeah. Frequently, if you're diagnosed correctly with a labral tear or hip impingement, there's special rehab we can have you into, right? And most people, I would say 80% plus, with that rehab will get better. And even if they're torn, they'll kind of get past that and move forward. But if you're not getting the right rehab, that's not going to happen. Some people do have to have surgery for that situation specifically. I would say that's the minority of people. And that is something I specialize in. But most people don't need that.
Right.
Most people just need the right rehab. And so I see a lot of people told, you have a groin pull, you have a hip flexor this, you have just a strain of your hip flexor, and we're going to rehab you. We're going to have you get some deep tissue massage and get you back out in the field. They keep playing, they keep hurting themselves. It doesn't get better. Get the MRI, you find out, well, they had a labral tear of their hip the whole time.
Man, and that's the thing, is that let's see, what's the word I'm looking at? Those answers actually starts where? Not at the doctor. Is it well, let me bring it down. Let me bring it back. When they're diagnosed, who diagnoses them? Well, I guess you don't want to put that stuff on there. I don't want to do that.
Yeah.
I don't want to do that because I don't want to get you in trouble. I had to catch it myself. But let's say if they go to a general doctor,
Sure.
and just say they go there and the doctor tells them, okay, just put some ice on it that day.
Right.
Then they end up going to see a specialist yourself.
Right.
That's where you find that comes out. Let's just
Right.
Okay.
Right. But yeah, I think the goal is that I won't say names, but
You're right. That's what I said.
But at every step along the pathway, right, we got to raise the level of education and understanding, right? And so if you're being diagnosed by a primary doctor, we need to make sure that they understand the sports health. If you're being diagnosed by an athletic trainer at your school, we need to make sure that they are up to date on the highest level, right? So they are knowing, okay, well, this is something I need to take a closer look at, or maybe I need to go ahead and speed up the referral process,
Right.
to get them where they need to be.
And that's the thing. The referral is the problem. Because sometimes I might give you, okay, let me give you a referral. That referral might not happen for maybe another couple of months or maybe a week or something like that. How do we change that?
That's difficult. So it's a couple things. So advocacy is important.
Okay.
And advocacy comes from knowledge. All right. You have to know what you're advocating for yourself for to know what to ask for.
Okay.
Right. So that's where learning the basics about, for instance, what an MRI even is, what it does. Hey, you got an X-ray, everything's fine. Something's still wrong. Maybe an MRI is something that we need to at least think about at some point in our treatment pathway. So there's that part. And then we need to see, I guess I'll go back to the advocacy part. So you being to advocate for yourself, right, as a patient or as a patient's family member, right, allows you to come in and ask, hey, I need to see, we need to at least talk about this study. And then you knowing who you need to see is another big thing in the healthcare system.
Okay.
So where people get stuck or maybe confused is what type of doctor should I be seeing for this, right?
I went through that personally.
Yeah.
So yeah.
And look, man, I'll admit it's confusing, right?
It is.
Like, I'm an orthopedic surgeon. Some people think orthopedic surgeon, okay, you replace my knee. But I don't do knee replacements. I work on sports injuries, right?
Right.
Well, I mean, for you, you're thinking, okay, what's the problem? Just like I walk into, see a carpenter and he says, well, I don't do that. I'm gonna be like, what's going on? But I thought you was the guy.
I thought you right. Exactly.
So I fully recognize it's a confusing
It is.
Pathway. So getting the information out about who does what, even within specialties, within orthopedics, there's like 13 different specialties. There's hand surgeons, there's orthopedic tumor doctors, there's joint replacement. I can go on, the sports medicine, of course, right? So, I mean, getting the information out there so people know who to even ask for is a step. And then, but one big hurdle when it comes to referrals, I said this last time we were on, is insurance. So who you're in network with, who you're out of network with, what your insurance will allow in terms of referrals. The problem is, and like I said last time, insurance has been tied a lot to employment,
Right.
and that's societal, right? And so you are effectively, a captive audience to your insurance, right? Because your employer, in most cases, has made an agreement with a given insurance carrier. So it's not like you can shop around, at least not easily.
No.
I mean, you can, but that's hard. Yeah, right. That's going to cost you. Yeah, right.
It's going to cost you.
You go into that exchange, the healthcare exchange. It's no joke, right? So it's not like you have an easy way to like shop around and get a better insurance. So some of what you can do is dictated by what your insurance will allow. And so while you can't change that easily, you can at least understand it. For instance, some insurances will not allow you to see me as a subspecialist without a referral from your primary care.
Yeah.
But then a lot of people don't have primary cares.
So right.
So then you're stuck in the cycle, right? So you understanding, hey, look, maybe I should, figure out what my primary care situation is in the event something happens to me, especially if you're an athlete or have young athletes with you. So you understand what the steps are going to be. Some insurances are going to limit who you can see or who they'll pay for you to see. And that comes down to what we call in-network versus out-of-network. In-network has a lot to do with that healthcare organization and how they have negotiated with your insurance.
Yep.
So you might remember Bonsecours and Anthem have had some, back and forth recently. That's caused some problems. Without getting into all the details, what I can tell you is that in-network has a lot to do with if the healthcare provider can basically agree with the insurance, right? If they can negotiate and come to terms and say, okay, we can work together.
Okay.
Right. And so a lot of that decision has to do with, insurance being the ones who kind of hold the purse, right? Hold the money. How willing are we to work with this group of physicians or providers? And then you as the patient end up having to deal with how those decisions go. So none of that is really your responsibility. But what I will tell you, though, is you need to understand who's in network or out of network for me, right? So that I know coming into where I need to go if I have a problem.
So what can we do now? Do we kind of as a community and what we can use our platforms? Do you think, we just have to just keep pushing this out there? Maybe with these, where do we need to start is what I should say. Maybe as far as like, maybe getting with some of these high schools, or maybe with the recreational leagues, whether it be the youth football leagues and basketball leagues, baseball leagues, stuff like that. Start there because these kids are starting younger and younger now.
Facts.
So I think maybe that's where we need to start to try to get, because like I said again, we're just out there okay, let's sign them up for this. Let's sign little Timmy up for little Sally up for this, and next thing you know, and then they get an injury, this is send to our primary care, and that's where it starts.
That's where it starts, yeah.
But then they still have these lingering pains and issues that we don't really know what to do. So I think, like I said, this is a good way to start.
Right.
And I think everybody needs to tune in. What days, when we get this platform started, how can one reach you? What do they need to reach you?
Yeah. So you can find us on YouTube. All right, the YouTube channel is Level the Playing Field with Dr. O, Dr. Owusu-Akyaw in full. You can see us on Instagram. All right, Instagram's under my name, Dr. O for the 804. Y'all have seen that before.
Yes.
You can see us on TikTok. Level the Playing Field is the TikTok.
I started seeing that.
All right, and so what you'll see is, of course, the long form videos, the kind of full episodes, and they're not that, but so long, 7-10 minutes. Y'all can handle that.
But that gives you a start.
It's a start, yeah. And then we have, kind of the breakdown, little shorts for those of y'all who want to, kind of scroll through things quickly. So we have shorts on YouTube, shorts on TikTok, shorts on Instagram Reels. So a lot of different ways you can get this information. We're trying to make it as accessible as possible. And I mean, to your point about people starting younger and younger, they're starting younger on the phones too. And so if we got to reach them on the phones, we will. We got to reach them on TikTok, we will.
We get them because look, 5-year-olds got phones.
Right.
They got the iPads, they got the phone. You got call them. Call who? What? So we got to.
Yeah.
So no, because everybody can scroll and access to a phone. So no, we definitely need to start there. And I just think that I appreciate you giving us this information, man. Because again, like we just don't know. Like I said, I just turned 50, and there's a lot of stuff I didn't know. I was like, man, what? I got to do what? Well, who?
Right.
Why couldn't you? Oh, okay. You know what? I'm not even going that way now. I'm going this way.
Yeah.
You know what I'm saying? So it helped me out. And actually, I just learned this, maybe 4 or 5 years ago?
Yeah.
So I understand. So don't feel bad if you feel stuck. It's like, well, I don't want to feel stupid. No question is a dumb question. So if you have any questions, contact my man, Dr. O here, and he gave you the platforms where you can reach it. If you can't reach him, contact and DM me at BallinVA _804. And like I said, we'll definitely reach out to you, or even Morissette Media. You know, anything else you want to kind of get before you we sign out, Doc?
Yeah, man. I'll give you one pearl. You mentioned something about student athletes get injured, and it's like, what do we do now? I'm going to encourage every parent with kids playing sports to have a plan, set up for how you're going to handle an injury. Part of that plan is being prepared in terms of your knowledge of what situations might entail. So you want to know ahead of time who's in network, out of network for me.
You need to know that.
You need to know that. Have an idea of who you might see for a sports injury. Get an idea of what the common sports injuries are and who you might see, right? Get an idea of physical therapists. So increasingly, the laws are changing such that you can see a physical therapist on your own.
Right.
Some insurance plans without having necessarily to have a referral from a doctor, right? Or a provider. And so being able to go see a physical therapist, having one or an office that you know of that you can trust, right, at least as a starting place. Because I'll tell you, a whole lot of physical therapists do an excellent job diagnosing. And that's just a fact, just because they see,
They see it all the time.
They see it all the time. They see it all the time. So, and a lot of times that might be one of your first stops if you have an injury. So knowing, hey, this is where I'm going to go, this is what we're going to think about doing, and knowing, hey, my insurance, rocks with this group, with this practice, is a great way to start. So having a plan, if you know you're going to be playing sports, preparing for the worst, just in case, is important.
Because a lot of times you're not really focused on it until the kid get hurt.
Exactly.
You're not saying, okay, well, look, let me increase my insurance here, because sometimes, it's a struggle financially and everything with these insurance premiums going up, and it's like the coverage is getting worse and everything like that. But sometimes you say, you know what, he's going to be playing football, he's in high school, this year playing varsity. I may want to get this type of coverage here. Right. And let me see who the doctor's here, blah, 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 because we don't do that. We don't think that way until it happens. I mean, it could be dental, anything like that. We just don't think that until you need it. That's you never know what you need until you need it. So what we're saying is be proactive now.
Yes, sir. Yeah.
And don't wait, because if you don't, it'll be too late. And then you have to wait till open enrollment, and Lord knows when that could be, So, unless you have like a situation where somebody lose their job or something like that, where at that point you can kind of make changes. But I have so many questions right now that's going through my head that might take a little bit longer. That's in regards to this, to something I know somebody had situations, but I won't take up too much of your time, Doc.
No. Look, man, the healthcare system is jacked up. There's no doubt, bro. Look. And look, we're not gonna change that overnight. But what we can do is figure out how to navigate it, right? To take care of ourselves and our families.
And I think if we know that, just that simple stuff, it'll help people.
Right.
It just help just simply knowing where to go, how to access it, who to call.
Right.
And I just know for me, ever since I've known you, a lot of people call me and say, man, I go to Dr. O, Dr. O. Yeah, man, give them a call. Just call the office and see what's going on, So I appreciate some of the people who reached out to me and actually started going to you now, just because before they didn't have access to that. I'm just glad to be a part of it, to be able to say, hey, I can be able to help somebody, to change somebody else's life, because I tell you, you definitely helped me out with my situation, so definitely educated me, man. But yeah, anything else you might want to add, Doc, that, we probably didn't cover, because I know if I go into this one question, it's gonna be another 20 minutes.
We could be a couple hours, bro, to tell you the truth. But we'll definitely lock back in, of course. What I tell you, man, is I'm just blessed to be a part of your community and your network, and I appreciate everything you've done to help make the connections, and we'll keep growing together.
Man, definitely, we got to keep doing this thing. Take this thing, way bigger than where it is, because we're just starting off, man. But I just think that. Just hitting the ground running. We got so many places where we can go, and I'm just looking forward, to the opportunity of working with you, man, just kind of more closely, because now it just got my eyes so open. Between you and my son, with being in that same field, not going to be a doctor, but just in that film of just training sports athletes, got to know this stuff.
Yes, sir. Absolutely, man.
I'm paying enough money for it.
Absolutely,
Yeah,
bro.
but it's gonna be worth it.
Yes, sir. Indeed.
Yeah. But yeah, man. So we're gonna sign out here from myself here, BallinVA, Dr. O from Leveling the Playing Field.
Sir.
We just want to let y'all say peace, and we'll see y'all later.
Next time.
Next time.